All right. So today we have Ms. Jill Davis. Jill has been a health educator with Humana for over 3 years. She's a certified lifestyle medicine professional specializing in using therapeutic lifestyle interventions to treat chronic conditions. With a master's degree in health promotion management and certification as a personal trainer, Jill has over 20 years of experience in health and wellness industry. She has worked with several community partners and industries providing health education and lifestyle coaching with a specialization in chronic conditions. So please help me welcome Jill Davis.
Thank you, everyone. Thank you, everyone. I'm so glad you're here. So just so you know how this works, I know that the Path to Wellness is how many weeks? 15 weeks. And I'm only going to be here for 4 of those weeks. But what you see that Denny handed out to you is a manual that has the coil binder. So that's what we're going to be using when you're working with me. That's not for the entire program, so you won't need it except for the weeks that I'm here, which I think all of you have that calendar of what those 4 weeks are. And if not, we'll go over them at the end of class just to make sure. If you happen to forget to bring that back with you, I'll make sure I have extras, so don't worry too much. If you forget it, don't, not come because you don't have it. So you'll see that. You'll also see a 7-day blood sugar log. That is optional, but why I give that out is so that you're able to track your blood glucose for your doctor, whether that's your primary care doctor or your endocrinologist. And you'll see you can actually put your meals and snacks and exercise on there too. That helps him or her paint the big picture and see what might be causing your blood glucose to go up or down. And that just lets them allow for better treatment. And then the other handout you have, you're going to see lifestyle goals. So when Janet introduced me, she mentioned lifestyle medicine. So what we do with lifestyle medicine is we use lifestyle change to manage, prevent, and in many cases reverse chronic disease. That being said, no promises here, right? But you're going to learn how to better control diabetes in our time together. You're going to have 4 different sessions with me, like I mentioned. We're going to be talking about something different with each session. So you probably already know I am with Humana, but that does not mean you need to be a Humana member to be here and receive the services. And there's other resources we have for you as well that you do not need to be a member for, including a whole virtual platform that you can go to health education classes, including diabetes classes online, and working with a health educator one-on-one. Although it's not in person, it would be either by the phone or through a Zoom meeting. But a lot of us have worked with people with diabetes. I mean, I was working with people with diabetes every day. So if you need more individual attention and you were interested in meeting with a health educator to kind of help guide you, hold you accountable, help with more individual things, let me know and I can help you register for that, okay? So we call these icebreakers because we want everybody in the group, you've already met each other, don't know me very well, but just to kind of get an idea if anybody would like to share what they hope to get out of this diabetes series. I would love to hear from you. If anyone thinks of questions during these classes that you want to run by your doctor or pharmacist or endocrinologist or whatever, write them down so you don't forget, right? Because I think all of us get to the doctor and like, I forgot to ask that. You're already on your way home, right? Go ahead.
Along her line, I was shocked to find out when I had a cortisone shot and then when I had the day after surgery, my blood sugar went. But they had warned me. So I was, it was just a day or so, but
Wow,
it doubled, tripled in one case.
wow, scary.
Yeah, cortisone shot will do that. I was warned also before I got home.
Wow, yeah. Sharing just like that is so important in a group because sometimes somebody else might run into that and they are not warned. So the fact that you just brought that up, hopefully that will help somebody else in case they're in that situation. So thanks for sharing that. Anyone else want to share before we move on? All right. Thank you guys. Okay. So these are the 4 topics that we're going to cover. You're going to notice what's in your manual, especially when we get to the nutrition part. I work for a Medicare company, right, Humana. There's a lot of legal and compliance involved. I tend to go down some rabbit holes because of the lifestyle medicine training that I've had. I've learned a lot more current research, and a lot of this is written with some of the older research. So you might see that what I'm gonna say, or what we talk about, especially on the nutrition side, is going to be a little different than what's in your manual. In fact, I might even have you cross some stuff out. So it's going to be based on more current research, but I want you to know that you might want to take notes in some cases, just to give you a heads up. So today we're really going to just spend time talking about the basics of diabetes, explain what causes it in particular. We are going to talk about high blood sugar, low blood sugar, what that looks like, what to do in those cases. We're really going to get into the basics. And then, of course, how to keep it in range and how to set some goals, which brings us to the SMART goal sheet you'll see that Denny handed out, where you can actually write down your goals in all 6 categories because they all matter. So you're going to learn about that too. Number 2 is going to be all nutrition. Don't miss that class. That's where you're going to learn how it's actually possible to better manage your A1C, and in some cases, depending on how you're able to apply it, depending on if you're still making insulin or not, depending on many factors, there are some cases of reversal for type 2 diabetes. But before you change any lifestyle habits, the first thing you want to do is let your doctor know you're making changes, especially if you are taking medication for diabetes. If you're taking insulin or if you're taking an oral medicine, please let your doctor know before you make a change, because very possible the changes you make your blood sugar come down, right? It's supposed to regulate it better. And if you're on that initial amount of medication, you could experience blood sugar lows. That can be dangerous. Yes, it's great if you control it through your lifestyle, but it's not great if you have a low that causes a dangerous situation. So make sure your doctor is monitoring you if you do get inspired and decide to make changes, okay? I've seen it when it hasn't happened and it can be dangerous, so always let your doctor know. And then 3, how to prevent complications. We're gonna go over what diseases and situations you might be at higher risk for, so that you can be aware of that, how to prevent them. And then class 4, we're gonna go deep into medications. We're gonna talk about the most commonly prescribed medications, how they work in your body, common side effects, and we can have a discussion about that too. And then, of course, how to be safe when it comes to taking medications, questions to ask your doctor about them, things like that. So that's what we're covering with your 4 classes with me. And again, we can go over what those dates are at the end of the class too. So today, first we're going to start with where diabetes comes from. So you guys all know in here, there's actually 3 types of diabetes. So there's type 1 diabetes, which you're pretty much born with, where you are reliant on insulin. You will never be able to reverse that type of diabetes. You can improve it, like Karen back here is extremely healthy, has not had complications. I know right, knock on wood. She's really taken a lot of personal responsibility in exercising and eating right and things like that. But she does have type 1, she will be on insulin, but she's not having complications, which is phenomenal, right? Then there's type 2 diabetes, which is about 95% lifestyle related. And that's the one that can be reversible depending on your situation. And then there's a third kind, which is an autoimmune type of diabetes. And there's various tests your doctor can do to determine what type you have. But most people who have diabetes have type 2. And that's something that's unfortunately growing in this country. In fact, if you look at chronic conditions for so many different zip codes, number 1 chronic condition is diabetes. Seems to be the most common. Of course, there's always heart-related issues, cholesterol, blood pressure, things like that. But diabetes is probably one of the easiest to prevent. And we're going to get into why. So you can see up on the screen, there's 2 different cells here. The first one is the properly working cell. So the way insulin resistance works, have you guys heard of insulin resistance before?
Yeah.
Okay, so that's how type 2 diabetes starts. It starts with insulin resistance. So what happens is, over time, you see that hole, that blue hole on the top? That's the glucose channel. That's how the glucose gets into the cell. It's like a little door, right? Over time, that little door gets gummed up, almost like somebody chewed a piece of gum and stuck it on there, right? So when the insulin tries to get the glucose in, if it's already gummed up, it can't go in the cell. So what happens to it if it can't get into the cell for energy and whatever the cell needs to use it for? What happens to the glucose? It just floats around in the blood.
Is that why my mom said, don't swallow my gum?
No. But that is a great question because of the analogy that so maybe I should be more specific with how I explain things. So, what gums it up is fat, saturated fat. So what happens is, over time, when we eat, it's mostly animal products, right, that have saturated fat. Plants don't have saturated fat. So over time, that fat goes into the cell first, before the glucose. So when it starts to build up to a certain amount and gets full, and the insulin brings the glucose and knock, 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 let me in. I'm sorry, we're full. You can't come in. Glucose can't get into the cell, which means it's just going to stay floating around in the bloodstream. That's what causes the higher blood sugar level, right?
So that's why eating less meat and more plants, fruit and vegetables, you have less saturated fat.
100%. So, in essence, that's how we make, and we'll get into this more in depth. Today is just kind of a basic overview, but that is why a lot of the lifestyle medicine research shows that if you eat less saturated fat, eventually that fat gets out of the cell and the glucose can get back in. So when you have that insulin resistance going on, your insulin is not doing its job, right? So over time, your pancreas is going to make more insulin, more insulin, more insulin, trying to get that glucose to go into the cell, but it doesn't work, right? So eventually what happens? Pancreas is going to burn out, stop making insulin, and that's when somebody with type 2 diabetes ends up on insulin. Does that make sense? So we really need to keep that cell open, and it's called insulin sensitivity. That's what we want. Insulin resistance is when the glucose cannot get into the cell. Does that make sense, what I'm talking about? It's kind of a complicated process, but I try to keep it simple. Did you have a question?
Yeah, just out of curiosity, do vegetarians get diabetes?
they're not as likely to. But again, 95% preventable, there's always exceptions.
Yeah.
Because
Yeah.
so many different things can lead to diabetes, so many different genetic factors, so many different environmental factors. Even stress, as you were talking about, can raise your blood sugar. So it's hard to say, right? There's also infections that can cause issues like blood sugar issues. So most of the time, it's related to lifestyle, but not all the time.
Can you help me understand blood sugar? Is that insulin?
So let's
Glucose?
go to, I'll come back to this stuff. Let's talk about blood sugar right now. So when you eat anything, pretty much, it turns into glucose, which is blood sugar. So glucose is energy, and that's what your body uses. Your brain uses the most out of every other body part, right? But that's what your body uses for energy, which is why it's so important to get into the cells. When it's floating around in your bloodstream in excess, that's where these numbers start to go up. So A1C is a 3-month average of your blood glucose. So it basically just says, okay, my glucose ranged this much in 3 months, here's what the average was. So 6% and higher, 6.5% and higher, according to the CDC, is considered diabetes. When you're from 5.7 to 6.4, they call it pre-diabetes. When you're under 5.7, you don't have pre-diabetes or diabetes, right? But your doctor could tell you if your numbers start to creep up a little bit that you're starting to get insulin resistant, right? And that could be something that potentially could turn into diabetes, right? So next to the A1C, you see where it says EAG on the screen. And I believe this is in your manual too. That is the exact number of blood glucose. So if you go to the doctor for your fasting glucose, right, it should be under 126 is what they're looking for. That's where they want it to be. But that is what translates to the A1C beside it.
Is that blood sugar?
That is blood
So
sugar,
when you ask this here, what is your blood sugar? It would be something like that.
Yes.
298.
100%. Sometimes what people don't think about though is if your A1C, when you go to the doctor, is 6%, and you're not testing your blood sugars throughout the day, you could literally have a blood sugar spike at night of like 300, but in the morning, if it's low enough, that's gonna give you an average A1C that's within the number you're looking for, right? Which is why a lot of doctors ask their patients to do the monitors, right? It's a continuous glucose monitor. We're gonna talk about that a little bit too.
So EAG is your daily, is what your daily average
Yes,
blood sugar level would be.
yes, and that's how they get the A1C number. Exactly.
That's what you're kind of averaging every day.
Yes, so let's just say your blood sugars average 140 over the course of 3 months, then you're gonna have an A1C of 6.5 on your blood work. Yeah, great question.
So the meters, blood glucose meters, they don't give us an average A1C.
Nope, they give you real-time blood sugar,
Yeah.
which is great. Highly recommend having one if you don't. Yeah. Because finger sticks, you know, they're great, but they don't always tell you in the middle of the night if you have a crash or, you know, if you get super stressed over something, you have a spike. Finger sticks don't always tell you that stuff.
So what does?
A continuous glucose monitor, which you probably will not need. Your doctor would only request it if he senses that your A1C is going up.
Well, I have a pod, I have the Libre 2, and the thing wakes me up in the middle of the night when I
Yes, it
have a
does.
spike in
Yes, it
blood
does.
sugar,
Exactly.
280 or something like that.
Yep, yeah.
It's, and I'm a light sleeper, so I wake up and then I can go back to sleep.
Ah, that's
Why
why.
would I spike at night?
Everybody
You're not
is
eating, you're not
different.
doing anything.
It can even be something as simple as cortisol, which is a stress hormone.
Yeah, mine's drops.
Sickness can do it.
Mine's just drops.
Overnight, too.
Mine's goes way down. I gotta get up and get a piece of candy or some apple juice or something. Mine's just dives every
Yeah.
night. At about 3 o'clock in the morning,
Yeah.
most nights it just,
Yeah. I'm glad you guys have those alerts set because that can be dangerous otherwise, right? And that's exactly why I always tell people, see your doctor, right? Before you, imagine you started exercising differently and changed your diet even more, you get even bigger drops. So it's always good to tell your doctor about stuff like that.
I don't want to measure, but what I'm hearing you say, if I did measure, it would, and I assume you do it multiple times a day, it would sort of show you, like you were saying, yours drops in the middle of the night, you know, what if mine jumps way up at this point in time?
Yeah.
Then I could start thinking, well, what did I do at that point in time? Did I just
Exactly.
finish a cheer line?
Yes.
What was it?
Exactly.
And then that would help me, all right, cut back on that. You're gonna
Yep.
cut back on
It really is a good learning experience to see what makes it spike and what makes it drop. And that's why you guys all have that log and you can write down your meals, you can write down any notes that you can think of along with your blood sugar, because then when you take that to your doctor, they can see where the patterns are and it will help them treat you, right? It will help your treatment.
The continuous glucose monitors, I think those are for people only with type 1, no?
No,
You can get them for type 2.
Yes.
You have to be above a certain A1C level.
For Medicare to cover, you have to either be dependent on insulin or have uncontrolled glucose. So like if you were to be able to prove, even if you had an A1C of say 6, but you could prove at night you drop dangerously or you spike dangerously, you can ask your doctor to write a prescription, and as long as you have that track record, Medicare will cover. And also, in case your Medicare doesn't cover, you can go to some pharmacies and they have a cap on what they can charge for, I believe it's the Libre, but I did it on myself as an experiment, and I paid $75. You do need a prescription from your doctor, but they cap it at 75. So there are some pharmacies that will cap it for you.
Is it
Great question.
75 a month for the supplies or?
Yeah, I only did it for a month, but yeah, it was for two Libres, which was 2 weeks changing them. Yeah.
Well, I get my pods from St. Joseph Medical, and if you're on Medicare, I have a 3-month supply that is free for me.
So you're not on insulin?
Oh, okay. Because I'm on insulin, so morning and nights.
That's something else we could always talk about after class too. I mentioned you don't have to be a Humana member to take this class. But if there are Humana members here and you're wanting to get information on, the best rates for your diabetes tracker or your medication or whatever, we can talk about that and what your benefits are. And Karen would be the person to help with that as well. I'm not an agent, Denny's not an agent. We don't know about benefits, but we can connect you.
We have a customer service.
Yes, we have customer service kiosks in the big green monster van out there that says Humana. You can connect to a live agent and ask about any of that stuff. How much, what's my copay for metformin, or how much can I pay for a Libre if I take it to this drugstore? They can answer questions like that.
I think the government, I'm not sure if it's the federal government, put a cap on
Insulin.
diet, yes. Diabetic
Absolutely.
medication.
Yeah,
Let's see how long.
35.
Sometimes do, if I
Huh?
listen.
Please do.
UNC and Duke, both of those networks, if you are at a certain income threshold, they have charity care there that will assist also. You have to apply through either UNC or Duke. But they do have
Do you
Good
have
to know.
to have their insurance?
No, you
Or just
still
go
have
through-
your whatever insurance you have, you just have to meet their income requirements. And they'll help out with certain things.
Okay.
UNC or Duke.
It's good to know, Karen. Thank you.
You're welcome.
Awesome. So, different ways to manage diabetes, right? I'm sure all of your doctors have already talked about this stuff, so I'm not going to spend a ton of time on it, but eating the well-balanced diet, we're going to get into nutrition big time, class 2, so I'm going to save all of that for then. Physical activity is very important, and something a lot of people don't know is that when you exercise, your body doesn't require insulin for the glucose to enter your muscles. During exercise, I'll repeat it, during exercise, your body does not require insulin use to make the glucose get into the cell. So if for some reason you end up having something sweet for dinner or as a dessert, you can go for a brisk walk. And that will help the glucose get into the cell without the use of insulin, okay? That's not a permission for everybody, but it's good to know that exercise acts like insulin.
So after my cheer line.
Back to the cheer one. I'm gonna see if there's somebody that I know that makes house visits to check out people's pantries and get rid of all the junk. Put it in a trash bag, replace it with the healthier stuff. But that's good to know about exercise. Of course, taking the medications as your doctor prescribed them, right? Trying not to skip doses, taking them with or without food, whatever it is they tell you to do. Maintaining a healthy weight, because of course, if you're overweight, you're at higher risk for a lot of different things. Monitoring glucose levels is important just for the reasons we just talked about, because sometimes you're not aware that you're spiking, you're not aware that you're dropping. When you spike, you don't really get the symptoms, right? But when you drop, you feel it, right? But sometimes, like when I told you I wore the monitor for a month, I had a lot of stress in my life. You guys understand being a caregiver for my mom, and I had such a stressful day. I ate so well, I exercised that day, and my blood sugar spiked to 300 because of stress. So that's very important to know, right? That stress can be a factor. I don't have diabetes.
Yeah, that's crazy.
Yeah,
Oh, wow.
I know.
So I'm probably the cause of my wife's diabetes.
You might need to ask her, or maybe don't. Yeah. And working closely with your doctor is very important too, because they need to know these things, right? They need to know that you're spiking at night or you're dropping at night, right? Because that might mean an adjustment in medicine too, right? So all 6 of those things are important. So 2 different things that cause blood sugar or blood glucose to get out of range. Hyperglycemia. When you think hyper, it's too much, right? Like if you have a hyper friend, it's too much, right? Or hypertension, high blood pressure. So hyperglycemia just means high blood glucose. Hypo means not enough. So hypoglycemia is below target range. So what is target range? Oops.
Jill, excuse me.
Sure.
Some of them are asking like what page are these
What page?
slides in the books?
Yes. So we are in chapter 1. And let me just see what page this is. I kind of hopped around in the beginning, so I apologize for that. Right now, I'm on page 10.
Thanks.
Thank you for letting me know. So, we're just going to briefly just cover how to check your blood glucose, because we spent enough time on the A1C, and we'll probably talk about that a little more in depth later too. So how to check your blood glucose if you have the testing strip, right? Which is, they also say finger stick. You of course want to wash your hands thoroughly. You want to make sure the meter works, right? Because sometimes the batteries die, sometimes it malfunctions. So test the strip, test the meter by putting the strip in, make sure it turns on, gives you the signal. Then you put the needle in the lancing device, which is the little spring that springs it into your finger, right? And then gently squeeze the finger to get the blood out, and then you can scoop it onto the strip. Wait for the meter to show the result after you plug it back in, and write down your number and the time of day you took that number, and whatever other details you can think of. Like, I'm super stressed today, this is what happened.
Yeah.
Or I'm sick today, I have a cold, right? Because that can make it come up too. Or I didn't eat dinner, you know, whatever notes you can think of, because then you can start looking at patterns. And that just helps you manage it better, right? Just knowing what the patterns are. So the continuous glucose monitor, sounds like a few people in here already have it, but the good things about having that, we talked about most of them, but finger sticks get to be a drag, right, over time, especially if somebody's glucose does go up and down frequently. Imagine all the times you'd have to stick your finger, right? When you wake up, before breakfast, after breakfast, before lunch, after lunch, at bedtime, maybe in the middle of the night. Whereas when you have one of these monitors, it monitors everything in real time. Plus you can set, or your doctor can set alerts to give me an alert if it drops too low or it goes too high, then you know what you need to do something, right? And we're gonna get into what to do next.
Mine is connected to my doctor's office, so.
Perfect. That's awesome. That's great. There are some barriers that people don't like these monitors, right? Because they usually require Bluetooth, and that means technology, right? So usually you have to be comfortable with using the app on your phone. Some people don't like putting the monitor in. Sometimes they'll go to the doctor's office or have a nurse do it, things like that. And that can be every 2 weeks. Once in a while, they might fall off, you know. So there are some barriers to that. It can be a pain, but overall, it is a good tool, right? You do have to wear it at all times, and then sometimes the cost and approval can be a factor depending on where you are with your diabetes. But I think the pros outweigh the cons in monitoring full time. All right, so we talked about people experience low blood sugar, people experience spikes. So here's what you do. So low blood glucose is considered a level that drops below 70. That's when you need to do something. Sometimes though, you can still feel the drop, even if it's like 80, and I see heads nodding, you've experienced that, right? Tell me some symptoms that you guys feel when your blood sugar drops. Go ahead.
Everything inside shakes. I mean,
You shake.
and it happened to me last year. I didn't know. I went shopping at Walmart, and I got out of my car, and everything was like, so I asked the gentleman, I said, can you go and please get me a bottle of orange juice?
Good.
And he went, and then he called the ambulance because my blood sugar was down to 61.
Okay, yeah.
And I was like shaking inside, like.
Does not feel
They wanted to bring
good.
me to the hospital, so. But I didn't know back then that I needed to carry something at all times. So, taught me a lesson.
Yeah.
I see spots.
Oh, okay, yeah.
What did she say?
She said she sees spots. Yeah, kind of like a dizziness. Yeah. Anyone else have experiences with low blood sugars?
It's like a heart rate.
Oh, yeah.
Kind of stuff, I can be sitting, and it's happened a couple of times, and all of a sudden it's still shaky, like, like a sudden thing.
Yeah, it can hit suddenly, the symptoms. Yeah, scary. It can be scary too if you don't know what's going on. Yeah. Go ahead.
I've been waking at like 3:30 in the morning like this way, and fast heartbeat, and then sweating.
Yes. Yep. All very common
A little
symptoms.
disoriented too, a little confused.
Yeah.
Weakness in your legs.
Weakness in the legs. Yeah. Yeah. So you can usually feel it if your blood sugar drops below 70. So have you guys ever heard of the rule of 15? Have your doctor shared that with you? No.
15
Yes. Yes, so this should be, I think this is in your this is in your manual on page 12, thank you. Yeah, so you don't have to memorize this. So rule of 15 is if your blood sugar drops below 70, you're going to use 15 grams of a fast-acting carbohydrate, and you'll see some examples here. So a tablespoon of sugar or honey, 3 glucose tablets, which I think are great because you can carry those in your purse all the time, 4 ounces of juice, fruit juice, 4 ounces of soda. There's your cheer wine. You get to have it only on blood sugar drop days. And it says 4 hard candies, but it wouldn't be hard candy, it would not be fast, so you want something chewable. Something really common when people do get that drop is you do feel desperate, right? You just want to make that uncomfortable feeling going away. So a lot of times people have too much carbohydrate and then they go the other way, right? So it is very important to try to stay patient and really focus on 15 grams. Then you wait 15 minutes and check your blood glucose. If it is not yet above 70, you do it again. 15 grams again, wait 15 minutes. It should come to normal range. If it doesn't, that's when you call emergency help. But otherwise, you want to stay at that 15 grams so that it doesn't go too high. And then you can just have a regular snack after that to maintain that blood glucose. Go ahead.
And I had ignorance. I think of carbohydrates, I think of bread. You just showed the carbohydrates of sugar, honey, glucose, orange.
Because they're fast. So bread's more, it has usually, not all bread nowadays, but usually it has some fiber in it. So that will delay its breakdown. So you want something that's super fast to get in your system and absorb.
A lot of people say orange juice.
Yeah, that's a very common one. Yeah. Yeah. Go ahead.
And it's also important, if you're going to exercise, have something to eat before.
100%.
Because I have a lady in her class, she thought, oh, she wants to lose weight, so she's not going to eat. Middle of the class, he's gone down.
Yes.
So you got to eat.
Absolutely. Yeah. Yeah. You definitely want to keep that fuel source and glucose nice and steady. Have you guys heard of Joslin Diabetes Center? It's up in Boston, so if you haven't, I'm not surprised. I know you've probably heard of it. So they actually had a program with the health club I worked at. So the personal trainers were trained by Joslin, and they would take blood sugars for the people that were getting ready to exercise. They would take them for them before and after, and they'd have everything ready to go. It was really cool. And we saw some amazing improvements with the blood glucose from the exercise programs. But the reason I'm bringing that up is when you are exercising, make sure you can monitor your glucose. Check it before exercise, check it after. If you have a continuous monitor, you're going to see the numbers anyway. But it is very important because, like I said, exercise does not require insulin to take that glucose out of your blood. So it's going to be used and you could easily have a drop. So excellent point.
That's that point up here where it says doing more exercise can lower.
Yes, absolutely.
But that's what he was saying.
That's exactly what he was saying. And I have seen that drop being a trainer way too many times. So we would always have the glucose tabs ready to go.
How can having too much insulin, it seems counterintuitive. If I got too much insulin, how can my blood sugar be low?
Too much insulin?
Yeah.
Because if you're giving yourself insulin, so this is talking about as a medication. So if you give yourself too much insulin, that's going to bring the blood glucose out of your bloodstream into the cells, and it might take too much if it's too high of an insulin dose. Because you need some blood glucose left for energy. Right.
Drinking alcohol reduces your blood sugar?
Yep, it can cause blood sugar drops.
You have to have like drunk, I mean, I like have to have that's not a problem.
Let me guess, you mix it in your cheer wine.
Well, it is cheer wine.
Wine that makes you cheerful. Yeah, I mean, yeah, I'm gonna try not to open up a can of worms here, but alcohol can definitely do weird things to blood sugar, including drops. But it is classified as a toxin, so no level of alcohol is good for you, but you know, my family's from Portugal, they make their own wine. I would be disowned if so balance, being safe, being careful, making sure you eat when you're about to have alcohol, and keeping it in moderation is very important. But monitor, we keep going back to monitoring that blood glucose, right? Just making sure, because if you see that it's at 75 and you haven't eaten yet, it will tell you, okay, I need to eat something or it's gonna continue to drop, and that could be an emergency situation. So just knowing your levels is gonna be a very big part of managing. Great questions.
So how much alcohol, when you say in moderation, you don't recommend alcohol, but then how much is
Too much.
fair?
Most health organizations say one glass a day
One.
for men and women over the age of 65 should be the limit.
Are you talking
Not
about,
coming from
Are
me.
you talking about wine, or are you talking about anything?
Any alcohol.
Like one of these.
So, no. There's always one. Do you know somebody one time in a class asked if she could just put a straw in a bottle of wine and that can count as one?
Oh, no.
Couldn't believe, that was a good one. So 5 ounces is wine, 8 ounces beer, 1.5 of the hard liquor. Am I missing anything?
Can I just tell you as a diabetic?
Yes,
as a
please.
cocktail, wine is the one that you stay away from, wine and beer. Tequila is really the one.
What's your name?
Tequila.
Can you speak
Yeah.
louder, please?
Tequila.
Tequila.
Oh,
Tequila.
tequila. It's the healthy, well, my endocrinologist told me.
Oh, okay.
Tequila or vodka are the ones.
Oh, okay.
Wine and beer, no, I'm not.
Good to know.
Her endocrinologist told her that. A doctor told her that. Yeah, it is not coming from Karen from Humana. It's coming from her doctor.
This is from personal experience.
That's what we're clarifying right now.
Yeah, because the wine and the beer have so many, again, carbohydrates.
Yeah.
Yeah.
Yeah,
And it had,
a lot of sugar.
beer has hops and all the other stuff in there.
Yeah.
So it could be presupposed, if you have other problems, it's like, I don't drink alcohol, period.
Tequila or what?
Good.
Because I smell it and I'm out.
Yeah. Yeah.
So I just don't mess with it.
Yeah, my mom didn't like it either. My mom was. But yeah, tequila supposedly is one of the cleaner, less chemicals, safer alcohols, and then vodka, the lighter ones are known to be the
The
healthier.
dark ones are bad.
The darker ones are, yeah. So Karen's doctor is correct. Yep. So that's the rule of 15. So do you guys have an emergency kit, or do you carry some safety products with
I
you?
carried my glucose tablets
Tabs.
Good.
I got tabs.
for class in case someone passed out.
Good.
Always have a big piece of hard candy.
Okay, good.
So what, I wanna ask about the tablets.
They melt fast.
Because I was shown a tablet by someone, they didn't have it here.
You
What,
can get them on Amazon. Sorry.
Yeah, you can get them on
They're in the
Amazon.
drugstore.
They sell them at
All
all
the
grocery
drugstores.
stores,
Grocery
drugstores.
The pharmacy has them.
The pharmacy.
They're
has
usually
it.
next to the
Just
pharmacy.
chew them up.
They melt
Yeah,
fast.
they look like big Smarties, candies, kind of, or Tums. Yeah, kind of chalky. They come in a roll. And I like those only because it allows you to count out 15 grams, because sometimes like if you don't realize half a cup of orange juice or half a cup of soda, at least you know those are 15 grams. And there's glucose gel too, but the tablets are great. Thank you for sharing what they look like.
I got from CVS.
So you always want to have testing supplies if you don't have a monitor, right? If you, especially if you are going to exercise or you tend to drop or spike, right? Or if you're going to be in a stressful situation, and always keep the glucose tabs or something similar to get you that 15 grams, right? And then you're going to want a way to test your glucose too, so make sure you have your testing kit with you along with the glucose, because you want to make sure it's bringing it up to where it needs to be.
And I've also heard cold water, ice and water, cold water.
I haven't heard that one.
I can tell you another thing too that I figured out just so after you get your blood sugar up, you know those little packages of peanut butter crackers?
Yeah. You mean like the
Three of
letters?
those. Yeah.
Yeah.
3 of those. At this point in my life, I find them disgusting. I always would carry them. I still do.
Yeah.
That's what I was taught, the protein from the peanut butter.
Yes.
Just an easy traveling thing to carry, yeah.
Well, that's Dr. Roy, she was my favorite. Down here at Dr. Ozark, UNC, Briar Creek, just put a little plug in.
Awesome, thank you.
Ozark, O-Z-Y-G-U-R-T.
Thank you, Karen.
Thank you.
Yeah, so after your blood sugar does return back to normal from the 15 grams, you do want to have a snack with protein to kind of level it off so it doesn't drop again. Because as you know, the 15 grams will work, but then it's gone, and then you could have another drop. So you want to eat something more substantial after that.
So the protein will help it stay in range?
Exactly. Yep. Awesome. Thanks, Karen.
I don't mean to.
No, actually, you know what? It's great because you have diabetes and you've managed it so well. I think it's important for you to share your experiences. So I appreciate the tips, and please keep it coming. I'm sure everybody.
She keeps interrupting.
No, you're helping. You're helping.
Oh,
You're
no,
not.
it's good. It's good to hear.
Yeah. Especially if somebody in here is new to this. You know, you're a veteran. Somebody in here might be new, new to diabetes. So these tips are going to help. So thank you. So high glucose levels, something else that's important. So there can be a bunch of things that cause it to go high. High carb foods, of course, we all know. But eating more than usual in general can cause it to come up. Of course, being sedentary can cause it to come up. If you skip your medicine, that's like a no-brainer, of course, it can come up then. We talked about stress, we talked about sickness. So both of those things can cause the blood sugar to rise. Side effects of medications, you were asking about that earlier, but specific medications you definitely want to talk to your pharmacist about. But yes, it can be side effects of medicines. And changes in hormones, especially women, because of the whole menopause thing and estrogen loss and all of that can cause blood sugar issues too. Go ahead.
Okay, I'm confused. It says above 180, but the test or the line to say that you are probably diabetic is like 130 around there or
Yes.
whatever.
Good question. So the number to diagnose diabetes is different than having a high blood sugar you need to treat.
Oh, okay.
So right now we're talking about what to do if your glucose gets above 180, basically. If it stays above 180 on a regular basis, your doctor's gonna change your medicine, most likely, increase or change. So the symptoms aren't always there though when it's the higher blood glucose, right? We don't always feel that one. Low, yeah, we feel that. High, not so much. So that's why it's important to monitor. You could get really thirsty. I've heard a lot of times that's how diabetes has been diagnosed for some people, because they go through this period where they just can't drink enough, right? Urinating often, another sign. Dry skin, which we probably all have right now. Feeling extremely hungry all the time, even though you've just eaten. Tired, fatigue, which can be a variety of things too, right? Blurred vision can be a symptom of high blood sugar. And infections and sores that heal slowly can be a result of high blood sugar. So a good time, this is what we do when we have high blood glucose. So if it's over or 180 or higher, these are the things that you can do to get it down. One is drinking plenty of water, right? Very important to drink water and not something with calories in it, because of course that can make it go up higher. The water can dilute the glucose in the bloodstream. Taking a walk, because like we talked about earlier, exercise doesn't require insulin to scoop the glucose up. So taking a walk will help your body use that extra glucose in your blood. If it's close to mealtime, you can skip dinner, skip a snack until it comes back down, right? And then still monitor and be careful. And then, biggest thing is ask your doctor what to do, right? Because we're all so different. We all have different health issues, different medications. So next time you see your primary care or your endocrinologist, you can always say, hey, what should I do if my blood sugar gets above 180? What steps do you want me to take personally? And then make sure you have that in a safe place, because a lot of times when you're stressed or you have high blood sugar, you don't want to have to think about what do I do. Just have it written down somewhere where you can get to it quickly. All right, so now we're going to do a little test and see how much you learned today.
Exercise class is supposed to start at 2.
Oh, is it 2 already? Oh, you guys need to go, right? Okay. Actually, you can do this for homework.
Yeah.
So when you look at page 17 in your book, you're going to see these different activities, and you can decide what these people need to do. It's going to give you a scenario of where these people's blood sugars are and when and how they ate, and you can decide what they need to do, okay? So that starts on page 17. And that's it. I mean, that's all we were going to cover anyway.
Awesome.
Really quick, I know you guys have to go, but I also want you to use that lifestyle goal sheet and write at least one goal that you want to work on between now and next time I see you, okay? One small goal, even if it's monitor my blood sugar every day or walk 10 minutes 3 times a week, something specific, okay? And Janet, did they all have a calendar of when class 2 is, right? Okay, so you guys all have that. So I will see you again for class 2 when we talk about nutrition, and you're gonna get a plate from Humana with portions that you can actually use in real life, and we're gonna cover what goes in each section and all of that stuff. So thank you guys, it was really nice to talk to all of you. Thanks for sharing, and we'll see you next time, next week actually. Thank you. Thank you so much.
Let's thank Ms. Jill for a wonderful presentation.
Oh, yeah.
Wonderful.
Thank you. Thank you. Thank you so much.